Good afternoon, everyone, and welcome. Thank you for joining us today. My name is Karen Bell, and I'm the Associate Director for Partners for Advancing Health Equity, or P4HE for short. We are based at the Tulane School of Public Health and Tropical Medicine, and we are sponsored by the Robert Wood Johnson Foundation. We are a national research learning collaborative that aims to bring together various sectors, including government, academia, civil society, philanthropy, and the private sector. We're seeking to harmonize efforts towards health equity and promote actionable solutions. And one of the ways we do this is by providing interactive spaces for activities like today's webinar on centering global and Indigenous solutions to health equity. We're bringing voices with expertise from global and Indigenous communities to provide a space for collaborative learning about the most pressing issues facing these communities. We acknowledge historic forces like colonialism, as well as contemporary structures that produce and perpetuate inequities. We also understand that these experts and practitioners like them have knowledge that may or may not be applied to other equity approaches, but we're seeking to honor non-US and ancestral perspectives that build healthier communities. We'd like to start by asking our audience a question that will bring together our mindsets for today's webinar. We'll be using Mentimeter for that, and you can access Mentimeter by scanning the QR code that's on your screen or by going to www.menti.com on your browser or mobile device and entering the code 85567120. So I'm going to do the same thing. That way we're all in this together. So going to menti.com and putting in the code on your screen or scanning the QR code on your screen. And you can hit the thumbs up when you have done so or when you're sort of in there to signify that we're good to go. And once we get a couple more people potentially giving the thumbs up, we can go on to the questions that will sort of bring us all together thinking about this topic. So soon you should see the first question appearing on your screen. All right, I see it on my screen on my phone. Here you can answer these questions whether you strongly agree, gets a rating of 5, and then if you strongly disagree, you give a rating of 1. So the questions are, I have a strong understanding of global health equity. I have a strong understanding of Indigenous health equity. Indigenous health equity affects me, and global health equity affects me. So you can go ahead and put your responses or how you're feeling or understanding these questions or statements, and then hit submit. And we will look at the results here live on our screen. All right, just a couple more seconds to respond to that. We're seeing some differences across the responses where more people are understanding that Indigenous health equity affects them, but not everyone. And then we're also seeing fewer people say that they understand Indigenous health equity. And then also giving a rating of neither agree nor disagree, kind of, for I have a strong understanding of global health equity. So you can continue to respond to the questions if you have not done so, but also think about, or at least reflect on what's driving these differences in responses across the types of questions that we're asking. And, you can put your thoughts in the chat or have questions prepared for our panelists when we start to speak to them. Okay, I think we can go to the next question. And that question says, what role do you play in affecting global and Indigenous health equity? Okay, this one is potentially a little bit more complicated, or maybe something that you might need to think on a little bit more in depth. So we're going to take some time to respond to this question. What role do you play in affecting global and Indigenous health equity? I'm going to put my response. I'm going to be honest. You can put your response too. And you can actually put more than one response. This is the beauty of using Menti and working together to discuss these topics, is that we can see what other people are thinking and then also reflect on what other people are thinking to potentially change how we think. All right, so we have some responses here: advancing global learning. It's also potentially possible that our panelists can also respond, so that might be something that happens. Someone is sharing an experience about growing up on a reservation and bringing that experience with me into spaces as I enter as a public health student and researcher dedicated to health equity. Thank you. That is something that I think needs to be done, needs to happen much more. Also thinking about people like myself, who is Black American, and how my experiences growing up and living life can impact the worlds that I'm in, and the same can happen for everybody. Another person says, vote for and support efforts that facilitate Indigenous self-determination. Yes, we're going to talk about Indigenous rights, and listen to their voices and use my privilege to support. Yes, that is one of the factors or things that matter when we're talking about allyship, which someone else brought up. And someone said, I don't know sometimes, which is totally fine if you don't know. That's why we're here. We're here to learn and again, uplift those voices. So thank you all for your responses. Again, if you want to continue to talk about them, please feel free to do so in the chat. We will likely discuss the questions that you bring up in the chat. You can also join this conversation with your questions and comments beyond this webinar by tweeting using the hashtag partners, the number 4HE. All right, so now I'd like to welcome our guests for today. First, we have Dr. Karobi Acharya, the Senior Director of Global Ideas for U.S. Solutions at the Robert Wood Johnson Foundation. Next, we have Dr. Vivian Tatiano Camacho Hinojosa, who is the National Director of Ancestral Traditional Medicine at the Vice Ministry of Ancestral Traditional Medicine in the Ministry of Health of the Plurinational State of Bolivia. And then last, we have Dr. Kirk Skirto, who is a family physician for the Tonawanda Seneca Indigenous Nation in what some refer to as New York State. So all three of you all, welcome, and thank you so much for joining us. I'm looking forward to not just an interesting conversation. I think that's one of the things in health equity, we sort of, are staring and looking at things in awe and sometimes in disgust, with the inequities that we see. But I think it's important for us to change our lens and discussion to not be particularly extractive in these types of conversations, particularly if we're talking about things that people don't know that much about, but really to be uplifting, supportive, and empowering. So that's what I want to do. So thank you all for joining us today. I want to start with Dr. Acharya. Could you tell us about your work and what you think is the value of learning from other countries or outside of the US to understand approaches to health equity?
Sure. Well, thank you so much. And thanks so much for having me today. So I lead I work at the Robert Wood Johnson Foundation, and I lead the Global Ideas for U.S. Solutions portfolio there. And so that work is really tasked with learning from abroad and bringing ideas from how other countries, other societies are improving health and well-being, and bringing some of those ideas here to the United States. I think it's our tagline in a way is good ideas have no borders. And we really believe that we have a lot to learn. And we particularly, I think, have a lot to learn from low and middle income countries, because those countries have made tremendous progress, many of them, in health equity specifically, in very low resource conditions. And so that's sort of the focus of our work, is understanding how other places have improved health equity. And we work across a wide range of topics that, at the foundation, we believe in building a culture of health, which is very much focused on the social determinants of health, understanding that the healthcare system is only one part of how we can achieve health and well-being. And so the global team tries to learn across a wide range of those issues.
Thank you for sharing that, and thank you for pointing out how we should be looking to low and middle income countries and describing why so. I think that sometimes that's a point that can be lost for people. So yeah, or even overlooked. So thank you for sharing that. My next question is actually both to Dr. Camacho and Dr. Skirto, but I'm going to ask Dr. Camacho to go first. If you could just explain or describe your work, maybe broadly, and how it impacts your interactions with the community that you serve. I think that's a great place to start.
Thank you so much. I feel so happy to share with you and honored to share with you this panel. Greetings from the plurinational state of Bolivia. Sumah punche kachun tukui kunapah, no gasuti vivian Camacho, kai Bolivia, koya suyo manta tiakuni hatuna paikui. That's my mother language. I am Quechua, indigenous, from the indigenous nation of the Quechua people inside the plurinational state of Bolivia. And actually, I am the former national director of ancestral medicine here inside our health ministry. And we are working promoting the respect for our ancestral traditions. We are working because in Bolivia, we are indigenous majority. So as indigenous majority, our government has been following different processes. One of them is to have this law of ancestral medicine. This law, we are the only state, we are the only country in the Americas region that has a law that recognizes spiritual guides, ancestral healers, midwives. So working with this, we are promoting our herbal traditions, our herbalism research, and also promoting the little laboratories that make communities with their natural products. So we have reached now about 150 products made from a community wisdom that have the different documents, sanitary registration and everything inside the health system. And also, we are the only country that have done this guide for COVID-19 and ancestral medicine. This is a document, official document of our health ministry. So I'm doing these things now, but actually I come from my community as a Quechua midwife. I do promote respected birth. I do promote the sacred birth space for our children, because it's very necessary to recognize that there is different ways of knowledge. There are different ways of being in the world. One of them for us is very necessary to recognize is our ancestral traditions, our ancestral spirituality. That's why we do respect our sacred places, and also we do honor our ancestors. Because of them, we are alive. And it's because our ancestors that they have kept alive our ancestral wisdom, and also spirituality is part of our ancestral wisdom. That's why I have prepared for you this beautiful fire. So with this sacred fire, I do ask of you to remember that you come from sacred places, to remember that you come from sacred lineage. Our history is not of 500 years. It's 500 years of resistance, but our history is millenary. So we are millenary people, and we need to remember this. And with this beautiful sacred fire, small little one to share with you today, I just want to acknowledge and recognize all the sacred territories and sacred lands that are joining us through this webinar. And also thank you for the sacred place that have taken our land. I mean, our land, every land is a sacred place. And we need to remember that those places, those energies are alive. So with this beautiful sacred fire, I want to say hello to your territories and greetings, and also to our spiritual guides and our ancestral traditions. They are alive because we are alive. It's because the wise men and women, they have survived persecution, they have survived colonialism, they have survived extirpación de idolatrías, idolatry persecution. And we are alive because as indigenous communities, we wouldn't have any other doctor, because doctors were only for white people in the city centers. It's because of the wise men and women of our territories, because of midwives. They have made us being born, and also they taking care of our ancestral healers, that we are alive as indigenous communities today in the world. So for all of them, this beautiful fire. So
thank you.
I do those things, but I come from my community, and also I am a former surgeon doctor. I have studied in the university in Cochabamba, but also in the university in Ghent, Belgium. I would work inside surgery rooms, but somehow life took me back to my ancestral roots, took me back to community. And I know that it's necessary to communicate and complement the wisdom, Western wisdom and ancestral traditional wisdom. Thank you so much. Halaya.
Thank you. Really, I was going to say thank you for the brochures and showing some of your work, but thank you also for demonstrating your spiritual and ancestral traditions for us. So thank you for sharing that. Dr. Skirto, would you like to share some of the work that you do, or describe what you do broadly?
Thank you so much for having me here today. This is a really great conversation. I'm so honored to be here. So I grew up on Haudenosaunee territory, what the colonists referred to as New York State. And I'm currently working as the family physician serving the Tonawanda Seneca Nation. They're part of the Haudenosaunee Confederacy of roughly 1,000 people doing great work out there. But I've actually done a career in global health. I've worked for more than 20 years, going around to different parts of the world, especially Sub-Saharan Africa, Caribbean, and Central America, trying to form partnerships with local people and to help them identify their public health needs and clinical needs, and try to form an empowering partnership, which, as an outsider, I'm very much in the background, and I'm simply responding to the small ways in which they would like me to contribute with the groups that I'm part of. So I write extensively about this in a book I wrote about global health called Doing Global Health Work: Approaches Which Really Make a Difference. And with this book, I trace my struggle, coming in at first as a man of charity. I was the community service director in a community service dorm, and I was taught global health is all about coming in and seeing slews of patients and outsiders designing approaches based on our wisdom. And guess what? We do not have the wisdom. The community there very much has the wisdom. They know what they're struggling with. They know what resources they have and where they want it to go to. We come from a long, unfortunate history of colonization and the slave trade in global health. That is the foundation of global health. And we need to be decolonizing and very much enabling local people to take the lead on all of their health programs. So I really trace major approaches to global health work that are very evidence-based, very empowering, and it can allow folks to work in the decolonization. These lessons from global health work, I continue to work with these organizations all around the world, but I very much apply them as well when I think of what the Tonawanda Seneca Nation, because I'm coming in there as an outsider. I'm descended from settler colonialists, and it's a very, very dark history, and I do not want to come in and tell folks what to do. You know, it's very important that I come with humility and take those lessons from global health and say, look, this is your place. How would you like me to operate here? I'm a guest in your clinic. I'm a guest on your land. And you have a much more holistic vision of health than Western society. And I embrace that. And can I be some small piece in that, partnering with your traditional healers and all the ways in which you are doing healing in an environmental way, in a social way, mental and physical. So thanks again for having me here.
Thank you. I would like to potentially do something that we don't always do is to ask about like specific health issues, or maybe even some of the ones that are most pressing that you are seeing in the communities that you're serving or in the work that you're doing, to sort of orient ourselves to understanding. Because again, this might not be an area that all of our audience is fully aware of or fully immersed in. So if you could share some of the health issues, and they don't necessarily have to be like health conditions, but just topics that are most pressing for you all. Anybody can go. Sorry, I didn't call on anybody, so anybody can share.
So, I believe that if outsiders are going to another nation, either within North America or abroad, I think it's very important to come in only by invitation, and only when there is a locally led partnership, and to foster this and to listen to the community members, listen to the analysis that they've already done on their health. Typically they're very, very, very familiar with the main conditions that are making them unhealthy. And they have thought deeply about the resources and how they can try to counter this. And how can outsiders help to do less harm, to hold them back less on achieving their goals? Because there's so many ways that Western organizations and nations are doing horrendous things in resource limited countries, and very much, well, first of all, creating their poverty in terms of the abuses with colonization, and slave trade, and neocolonialization, international financial institutions currently. But we really need to turn the tide back. And when I sit down with folks in the villages and have them, brainstorm in depth, what are your health needs? I don't ask them about clinical health needs, because the social determinants of health are really, really key. And they always, in each nation that I'm working in, they always bring up public health needs as being first and foremost. That's why I encourage anyone doing global health work, to get an education in public health. I think it's far more helpful than clinical medicine overall. And what do they typically mention? What mention needs of water and sanitation? Typically mention housing needs, the quality of their indoor air, because they're often burning fires for warmth and to cook food. These needs are really, really central. And many global health groups, they take the clinical approach, and they sort of avoid these larger public health issues. But look, if this is what the community wants to work on, you should be coming over with public health people. And more importantly, the majority of the work and the idea generating should come from local people, the local public health specialists there. And we really take a back seat in all of this.
I can maybe follow up on those excellent comments, because I really want to echo a lot of the same sentiments around the social determinants of health. And I think, as I think about the work that we do at the foundation, I think one of the core things that we do is really try to redefine what health is, and what it means to be healthy and what it means to be well. We take a lot from the WHO definition from so long ago, that health is not merely the absence of specific diseases, but it is about the complete social, mental, and physical well-being. And they include the social piece, which I think is really interesting. So I think we every day have a deeper and deeper understanding of some of those elements that have often been neglected. So the Surgeon General recently has been talking about the epidemic of loneliness and social isolation as a public health crisis. And we certainly see that really social connection is as important to good health as food, water, and air. We know there's data that social isolation is as poor a risk factor, as big a risk factor for poor health as smoking and obesity. So, I think, we need a more expansive definition and understanding of what contributes to health. So certainly social connection is one. I think another that is coming up more and more every day as we are living it is climate change. Right? Typically, we have thought about our health as being kind of the boundary as our bodies, right? Or maybe viruses and things that are coming into our bodies. But we need to include the natural environment. And this is where we have so much to learn from Indigenous communities. I mean, this is absolutely central to how most Indigenous communities think about health and well-being. It is to understand the interconnectedness with our environment. And certainly in the US today, if you're in Vermont dealing with the floods, if you're on, large swaths of the US dealing with the Canadian fires, with the drought in the Southeast. I mean, climate change affects every aspect of our health because it affects our air, our water, our food, and even our social connection, right? So just coming to a more expansive definition of how we think about health and well-being is it's very central to our work.
To continue this wonderful reflection, I would love to add that for us, we refer not only as one monocultural view of health, because we come from this monocultural imposition that we learn at universities, that we learn from schools that are with neocolonialism. They continue teaching us one monocultural view of health. So you imagine health and you imagine pills, hospitals, and you imagine doctors and the white clothes. That's the health you imagine because the corporations made you imagine you this. So we need to go beyond, because that's that sickness that we are talking about, not health. Health for our communities is healthy water, healthy air, healthy food. So we need to again rethink in which monocultural way are we thinking health. We are millions of human beings with our own cultures, our own identities, and also we have preserved this interconnectedness that Karabi mentions, but also Kirk, that has to do with the health of Mother Earth. If she is healthy, if we have healthy food, healthy water, healthy earth, it's the first medicines we have that we need to be healthy and to survive. And also, that's why we need to talk about health of Mother Earth and the respect for our ancestral traditions, because when our ancestral medicine, it takes care of sacred places, of sacred water sources. Also, it takes care with ceremonies of food. We have ceremonies for seeding, for harvesting, for sharing the food. And also, we need to talk about health as dignity with life. I mean, communities with dignity, free of violence, free of racism, because racism, epistemic racism, is continue denying our wisdom. Epistemic racism is continue, it prohibits and also it condemns our wisdom, our wise people, even today. So we need to go beyond this and to address again that we as humanity have preserved wonderful cultures with wonderful wisdom alive. It has to do with agroecology. If we are poisoning our food, what are we doing? So our food is our first medicine. So we need to remember this, because it's the wisdom of the humble, simple campesinos, the farmers, that have preserved this wisdom. So we need to remember also, for us, health is not you isolated. Isolation, individualism, egocentrism, egolatry, those come from colonialism, from a colonized mind. You think you are an individual alone, and it's so disconnected of your community and your environment. It is useful to be treated as a mechanism, not as a person. For us, health is community. I have worked with health promoters from Maya culture in Chiapas, Mexico, and they had this beautiful song. Salud es dignidad, salud es vida, sin injusticia y sin humillación, un pensamiento propio, un corazón, una comunidad libre y unida. In this simple verse, health is dignity. Health is a life without injustice, without humiliations, a very own thought, a heart, a community free and united. So we need to remember this. We are communities. We need to rebuild this spirit of community, because you feel the connection, holding hands together. And even if the situation is hard, you will hold hands and go on. And also, but we need to address, it's not only separated, isolated, but also we need to address that we are millions in the basis of the economy, because we have in this pyramid 1% that is traveling to Mars for making tourism. And all of us in the basis of the pyramid, we are paying with our lives the pollution of the water, of the earth, of the air, of the food. So we need to remember, without social justice, there won't be health for anyone. Thank you.
No, thank you, Dr. Camacho, because the two last things you just said were literally what I was thinking while Dr. Skirto and and Dr. Acharya were talking, is how all of these problems are interconnected. Like you mentioned the wildfires in Canada are affecting people in the US, in the southern US. And so we don't have these sort of international borders. They don't matter when we're talking about global climate change, right? So, and then even thinking about health with regard to the social determinants of health, and thinking about health not as the individual and a particular sickness, but as community. I'm wondering about, and somebody in the chat said these are big problems, and yes, that is a very impactful way to say it, because it's correct. These are very big problems. And I'm wondering how you all deal with talking to people who might not have the same view as you, but have a lot of power. And you mentioned, Dr. Camacho, billionaires and millionaires who have a lot of power, and even politicians. Like, how do you talk to those people who do not have the same understanding of health and the importance of social connection as a determinant of health, or even as the health indicator? Like, how do you all talk to people who do not have the same understanding as you?
Speaking on the topic of climate change, those are brilliant words, Dr. Camacho. So I really think that when we're talking about billionaires, the richest 1% in the world, they are the ones causing climate change, and indigenous communities are the one leading the way forward to a path in which we can actually avoid human extinction. If we do not follow the wisdom of indigenous communities, I don't think we're going to end up anywhere sustainable whatsoever. After all, indigenous communities have been living, in harmony with the world, with Mother Nature for thousands of years. In come the colonists, bringing the Industrial Revolution, and taking the land as if it is a resource to be made money out of. And my indigenous colleagues have been very, very forceful, I think, and wise in how they've shown me there's no such thing as owning land. We are all guests here. We're all part of Mother Nature. We cannot pretend that we own the land. They're leading the way in terms of the rights to nature movement. And this is a possible way that, if we build up momentum, we can counter the efforts of multinational corporations and billionaires as they try to just rapidly pushes to extinction for their own profit making. This is a huge global health concern. World Health Organization has listed this as the largest global health concern, and I believe that they're completely right. And I think we really need to look to the wisdom of indigenous communities. Even today, the industrial park they're trying to build right at the edge of the Tonawanda Seneca Nation, the DEC has just approved a permit even though they've discovered endangered and threatened species of birds there. They're just going to go ahead and make this large industrial park and invite any company to come in that they want to, despite a movement of opposition, which, by the way, the nation has asked me to join them. And I encourage anyone that's involved in global health work and Indigenous health partnerships, to not take a limited definition of health. I believe Indigenous people, are brilliant for defining health in terms of the environment. If the environment around you is not healthy, how could you possibly be physically healthy? So, doing this work to countering it is critical, and it's been going on, as Dr. Camacho mentioned, for 500 years. A good friend of mine in El Salvador was shot in the head for opposing Canadian mining companies, which were contaminating their water. I was working for years partnering with the Lenca Indigenous people in the mountains of Honduras, and Berta Caceres is a Lenca leader who fought very fervently to protect the environment, and she was also killed for this reason. So Indigenous people are taking these massive risks and dying in the process, and this is what we all need to be doing together. We need to be doing this as a society and backing up the important work they're doing, but letting them take the lead. After all, they're the ones that know how to live sustainably and to save us from extinction.
Maybe I'll just follow on to that. I think, you said these are big problems. It is true. These are huge problems, right? And it's hard not to be completely overwhelmed when you see sort of the scale of these problems and how they feel overwhelming, right? And yet, I think the other thing that we know is that small actions add up. I was just reading a piece about the turnstiles in the Paris metro. When you are entering a metro system, you go through, you give your ticket, and then you go through a turnstile, it clicks, right? And those turnstiles, they are now harnessing the energy from those turnstiles in a few of the stations. And they have plans to roll this out throughout the entire Paris metro system. And the estimates are that the energy harnessed by just everyday people going on their commute through these turnstiles, the estimates are that that energy will run the entire Paris metro system. And so I love that story because it feels like such a small and such a simple solution that when you scale it and expand it over time, it has tremendous impact. And I think that's, I don't know, when I get overwhelmed, that's what I feel like we need to be doing, is what are the things that we can do in our own lives, in our own spheres of influence, and our own faith communities and parent communities and things like that. What can we do to make these small changes? Because if we each do it, then it does really add up. So that sort of gives me hope. I think the other thing, just in terms of the corporate sector, while certainly there are many bad actors out there, I'm not going to dispute that at all. I've also seen the corporate sector, because they are tasked with risk mitigation and because they are tasked with looking into the future, many of these companies are far ahead in their understanding of climate change, right? Because they are already, if you look at the insurance industry and what homes are getting insured and what homes are not getting insured, they are well aware of which homes are going to be in a floodplain and which are not, because they understand the risks. And so, I think we need to be talking about, in a way, those positive movements a little bit. I think the last thing I'll say is I think we need a deeper understanding of what climate change really looks like for us. We've gotten a heavy dose of this in the US this summer. Climate change is not just about polar bears on melting ice caps. Climate change is about floods in Vermont and drought in the Southeast and all of those other things, not to mention, of course, all of the global impacts that we know about. So I think that is also part of what we need to understand, is that climate change is about the air we breathe, the food we eat, and the water we drink as well.
About the big problems, Yes, I was reflecting always. There are some people that would not listen to us, or maybe they just don't get the point that we need to unite. We need to talk. We need, even we are so different, we need to exchange ideas, because the diversity of ideas, the cultural diversity protects biodiversity. So we need to remember this. And also those huge problems. Some people would say, oh, humanity is causing climate change. It's not humanity. It is corporations, the big pharma corporation, the medical industrial complex, the agro-industrial complex, the warfare complex. They are so united. Remember that they have poisoned people in Vietnam with the orange agent, and then they made, with this orange agent, they made glyphosate, and glyphosate is for GMOs. So they poison your air, your water, the earth, and the food, and make sterilization of the seeds. So it's macabro. I mean, it's nonsense, but also it's against humanity. That's why we we talk about take care of Mother Earth, and it's because of community sense. We need to remember again, as a part of our cultural resistance, it has to do with taking care of each other, with loving and respecting each other, with reciprocity. Only taking care of each other, we will go on. That's why we need to remember, when we go to these huge problems, we feel so overwhelmed and hopeless and depressed and sad and cry and not understand. But you need to remember that you are not alone. And also our resistance is to build hope, to unite. Paulo Freire, great master, Maestro Paulo Freire, he taught us all of knowledge. Everyone has knowledge to share. Everyone, all of us have something to share and learn each other. All of us are masters, all of us are apprentices. So if we go humbly to learn from each other, so we can build hope again, because it's necessary. Like you were saying, we need again science at the service of humanity, not science at the service of some greedy, absurd people. So we need to remember also climate change, and talking about climate justice, because it's not the poor of the world that are feeding themselves with one meal per day. It's not, they are not poisoning the world. I mean, we need to remember this and build those movements. I belong to the People Health Movement. People Health Movement is a huge movement. If you could check www.phmovement.org, People's Health Movement, we are a huge network of people struggling, defending water, defending land, defending our rights. So we need to remember that we are together. And also for us, we have this beautiful movement, Alegremia. Alegría is joy. Alegremia is the joy in your blood. And how do you build Alegremia? Alegremia with the A of hope, las As de la esperanza. Agua limpia, healthy water, aire limpio, healthy air, alimento sano, healthy food, albergue, a home to live, aprendizaje, learning, arte, y amor, and love. All of it, you build your Alegrimia, and it is a community program in the north of Argentina that has been promoting in different places. But also we have a network, the International of Hope, because we need to rebuild hope again for us, for all of us. Paulo Freire said, we don't know what is coming tomorrow, but if we come together, maybe I bring something and you bring something, and something new can be born. El inédito viable. This something new is being born now, because of Karabi, because of Karim, you are bringing something nice and new to the table. So from here, something new and beautiful will emerge, because Kausai Mama, Mother Life, the spirit of life, is so strong and so powerful. No capitalism, no industrialization, no racism has been able to kill this. So we need to remember this. We belong to it. So we are bringing these new possibilities from humanity, because we are dialoguing, we are exchanging our thoughts, good thoughts, alin yachay in Quechua, with good heart, with alin munay, because we want to do things with alin ruay, to do things good. With a good mind, good heart, we can make it good. It's part of our indigenous wisdom as well. Thank you.
Thank you. It seems like I'm going to shift topics, but I'm not. I'm actually going to ask one more question and then like a closing question. Also, because we have someone from the audience who asked specifically about indigenous communities in Bolivia, I'm going to sort of build on that and ask about indigenous rights and how that might be an approach to build on toward equity, if that's something that can be discussed or considered. And then again, an audience member has asked specifically about if there are multiple approaches to health across indigenous communities. So that's kind of a jumble, but I think if you can respond to any of the words that I just said, that would be great. And then I'll ask my closing question.
Maybe because they have said Bolivia, I know that we have this law, that it is the result of the struggle of my people. Many people have manifested and have gone to the streets to make their rights respected. So we have suffered a COP in November 2019, and the speech of racism was so strong, because they would say, oh, the evil needs to go out because Pachamama was evil for them. So racism kills, gets us sick, and we need to address this as hard as it is, because we have reached this because our people have fought for it. Nobody gave us, because our people organized it. So we need to remain organized as communities to defend our rights, and nothing is guaranteed, because during the COP, no rights for anyone, because we need to remember that if we have a democracy, if we have participation, if we have the right to speak, it's because many women and men in history have struggled for us. Because as doctor, as a female being inside the medical school, it was because our sisters, they had to struggle for it during university time. Because you need to remember, we need to remember, when universities started in Europe, it was forbidden for women, because we were considered little animals without any intelligence. And also that colonial thought was transpassed to this continent, to our indigenous communities. So it is continued colonialism and racism inside academia. So when you are asking what kind of health do we have, we are struggling to build inclusive health system. We are struggling, but it's a struggling every day to make people remember, to make people acknowledge that we deserve respect. Our ancestral wisdom deserves respect. So I fight the struggle against racism, against violence, against patriarchy, against colonialism is every day. That's why we every day pray, make our sacred fire, and ask to the sacred spirits. As you mentioned, Berta Cáceres, she would speak to the spirit of the river. So we need to remember, even our sacred places, they are guiding us, because they also want us to be healthy, happy, good. We have not been born to be humiliated, to be put down like colonialism has made with our communities. Our ancestors, they dreamed about this time that we would be born to be respected, to be cared, to be loved, and to share this with our human community. It's not only for one little community, not only for my people, it's for the entire world that we make our prayers. So we need to remember this. Thank you.
That was really well said. As a public health guy, I have to stress the right to health. From treaty rights, often U.S. government in the various states have guaranteed, good health care, and it's just not happening. It's not being funded. Also, speaking of treaty rights, they've been violated left and right, and the land rights of Indigenous nations need to be respected, and there's so much work to do there. How can you have a healthy, productive society if you don't have much land, and the land that you do have is being taken over by companies that are finding uranium and finding other resources? It's just neo-colonization. So each of these rights really need to be respected, our movements, I think, need to be led by Indigenous people who would like to lead them, and the same is true, I think, of public health programs. Such an important issue.
I have very little to add. You both have stated this so beautifully and eloquently. I think the one thing I would say that I think we have learned so much from Indigenous communities is the importance of putting things into a historical context, right? And understand, thinking about time a bit differently. So understanding our ancestors, but also understanding what kind of ancestors we want to be. And I think that, that is a question. Yes, I see. That is a question I've learned from my Indigenous colleagues, because we have to understand the historical trauma, the pain, the violence, and we have to be able to heal from that. And we have to be able to develop a sense of identity and dignity and pride, as you all have talked about. But we also need to think about what kind of ancestor we want to be. How do we want to leave the world for our grandchildren and great-grandchildren? And I feel like too often in public health and social change movements, we don't think far enough ahead, in terms of the world that we are trying to create. We tend to think in maybe 3-year or 5-year things, and funders are part of the problem there, I will certainly admit. But I think that historical and future context are critically important.
Thank you. That's I agree. I've been thinking along those lines as well. I think to close, I would ask you all to think about that future that we should be imagining, and if you could describe it in one word, or rather could use one word that you would like to see in that future. If you could all sort of close in that way, and then I'll say thank you for being with us. But yeah, if you could share just one word to describe that future that we should be working toward.
I would say justice.
Thank you.
I would say interconnected.
Healing.
Okay, wow. All right. I knew that this would be a powerful panel, but I think I received more than I expected to, and I'm sure that our audience members did as well. So I just want to thank you all for being with us and for speaking to us and sharing your experiences and your thoughts. We really, really appreciate it, and we'll take this moving forward. So thank you all. We are going to close there. There should be a survey that you can fill out to sort of help you reflect on and think about what we have learned today, what is either practical or applicable from the work that we have learned about from this conversation that we've had, that you can apply to your own work or to your own experience. You can use the QR code, or the link is in the chat. With that, we will conclude our session today and invite you to join us for our upcoming activities on Wednesday, July 26th at 12 p.m. Central Standard Time. We will continue our newest workshop sprint series titled Research Synthesis for Evidence-Based Health Policy. Registration for that is still open. And also we will be back in September with our next set of webinars for the fall. Please stay tuned for that. We have more information about our upcoming activities, as well as a lot of other information on our website, partnersforhealthequity.org. Follow us on social media and help us spread the word by sharing our content that most interests you in your work. See you soon.